Hello, welcome. I'm Cary Sweeney. I'm the director of the UC Berkeley Retirement Center. My degree and master's is in gerontology, and I've been working in this field, hard to believe, over 24 years. I tried to pull together some information that I think is helpful from valued and credible sources. And I'd like to open up to questions for you today too. So be patient. There's 86 people on today's event, and we'll need you to um, put some of the information in the chat and just take time for me to get to it. This will be recorded for today. So those of you watching the recording, you are watching it from our YouTube station. So that recording will be sent out and you can look at it for a link to it in the Center Express, but you can also look at our YouTube station for that. All right, I am going to share my slides, see if there's any other. Okay, all right. All right, so let's do this. I think this is it. Yeah. All right. Okay. Everybody see my slide? Thumbs up, chat, etc. Okay. Wonderful. Okay. So, senior housing options. Last week we talked about sort of thinking about staying in your home, and that's important. Most people do want to stay in their home. There may come a point, though, for several reasons that you may want to move or change. You may would like to downsize to something smaller and more manageable. Like to build new community. Your neighbors are changing, maybe. You want to change in how you connect with people. The house burden is becoming, housing maintenance is becoming a burden. You and your spouse may need assistance with care and a peace of mind for any future needs. So you'll notice how I started with several things before I said assistance with care, because thinking about your home is much more, as we talked about last week, much more than just the home of where you go to sleep at night. It's the community, it's your transportation, it's where you get your groceries, it's how you get support, it's what you can afford. So what's important to you is what we talked about last week, and that's also very important when it comes to where you live. What are your needs? Where do you want to live? And what can you afford? And this infographic asks several questions. Do you need assistance? Do you want peace of mind? Do you want 24-hour supervision, housekeeping, prepared meals, specialized memory care, community or social events, and management with your chronic disease? So that we mentioned ADLs here. So I want to drive that home because when you're reading in the literature, ADLs is something that comes up a lot. It's how you are evaluated to go into a senior housing facility. ADLs are activities of daily living, and IADLs are instrumental activities of daily living. So why are they so important? Because it can give you a language to better analyze and talk about your needs. Like one says, well, what do you need? Well, I need a little help with housework, grocery shopping, laundry. Okay, those are your instrumental activities of daily living. You need a little bit of help around the house. But, I'm having trouble getting getting in and out of the bathtub or getting dressed in the morning. That's when you're starting to talk about ADLs. And those are, if you have more than several of those or more than a certain amount of those, that depends on the level of care that a community will accept you at. And so that's important to keep in mind as we're going through this. It's used in medical and senior care conversations to help you determine the right level of care. And they're first and foremost, they are concerned about your safety. So a lot of these communities their decision making is driven primarily by safety. When you understand your ability to handle both your ADLs and your IADLs, it's a hard one, you're in a better position to know how much help you need. So that's just, there is a link to this on the website and on the slides, and all the slides I give you will have a lot more information. So this is just though for you to look at because the words are just too much to look at. Okay, let's go to this one. Okay, now this is one I think you can use as a handout. Like if you've printed out the slides that I sent, you can kind of make notes next to it when we're talking about the comparison. This is the spectrum of formal um, sort of institutionalized care, if you will. Other than independent living, it is licensed by a department of some sort. So independent living, you can think of when you think of, oh, I just want to downsize to a condo. I live in a 4-bedroom house. My kids aren't around as much. The grandkids, it's too much to stay. They're not staying, or that it's too much to maintain. So, and I want to meet new people and explore new activities, find people to travel with, find people to watch movies with. Independent living, generally they have 50, 55 older. One of the residents needs to be 50 or 55 and older. They provide communal services, light services, some housekeeping. The maintenance is low. You don't have to care for a yard. They often have shared gardens. And they there's a cost to it, but and you can get medical care inside of one. Not to confuse you, you could get home health care just like you could in your home to come to these, but these are not medical facilities, okay? So we're going to go through more details about that. Assisted living is a licensed community. They tend to be called assisted living, and what we'll talk about, then they basically provide you with your help with your ADLs, to activities of daily living, bathing, dressing. A lot of times people that are help get peace of mind from these. Many of you here today are thinking about your own care. Some of you were here thinking about your parents or your loved ones' care. So it can mean peace of mind to the whole family, et cetera, that someone is going to be there. That is assisted living. Skilled nursing is typically what you would have considered. Maybe you had a parent go into a skilled nursing facility when they were no longer able to care for themselves. They weren't able to, they might be bedridden. They need 24-hour skilled nursing care. That is what's been traditionally called a nursing home. And that's one of the older models, and the assisted living model is sort of the newer model. Board and care is a type of assisted living. These tend to be smaller places. So like assisted living, like Belmont Village is a bigger place. They have over 170 residents, 3 levels of care, memory care. They have independent living and assisted living. Board and care is usually a home in a neighborhood. They provide some support. They usually are more affordable. They are licensed by the same people that are licensed assisted livings, the Department of Social Services. They are not, though, they don't provide a lot of help with the ADLs, the ones that are more like medical care. But they usually are like a family, and they are a good option for people that have that are relatively independent but just need a little bit of help. Memory care is typically inside of an assisted living or a continuing care retirement community. That's the next one. They help with dementia. They're usually inside of an assisted living. They are also licensed by the Department of Social Services. And then the continuing care retirement community is your life plan community. So think St. Paul's, SF Towers, some of these ones where you go in an independent living and you move through, and they have skilled nursing. Skilled nursing facilities are licensed by the Department of Public Health. Those are the only 2 licensing bodies for communities: assisted living, memory care, board and care, all managed by the Department of Social Services. These independent living are not licensed. In order to call themselves independent living, they have to have a certain number of, they have to have, it's just age limit, really. And then skilled nursing is licensed by the Public Department of Public Health. CCRCs are licensed as by both because they have assisted living, memory care, and nursing care. Okay, so that's your grand overview. And then we're going to talk about some alternatives to this. But let's look at some. Are there any, let me see, are there any questions at this point? Just before we go on. How good is the licensing and recertification of facilities? And they are up to date and reliable in terms of quality of care. Erica, I will provide a link in several slides to the Department of Social Services search website, and you can search on their latest licensure. For nursing home compare, there's another search engine. You can check on reports. I'll talk a little bit about that. Just because somebody has an inquiry or an investigation at their community doesn't necessarily mean that the quality of care is poor there. It means somebody made a complaint, and anybody can make a complaint, and the Department of Social Services or Public Health is obligated to go follow up on that complaint. So we'll talk about that some more. Any other questions before I move on? Brian, there was news reports of rapid COVID spread in communal housing for seniors. Is this a serious concern? Which types of facilities provide the best protection in the event of a future epidemic? Well, that would be a personal question that I would ask. When I sit down with the people, or if I know somebody that lives in a community, I would say, how did you handle COVID? What was your COVID outbreak like? What was your plans? How many disasters have you been involved in, and how have you planned for those? Those are very, very reasonable questions. I will say that, yeah, it was a rough in long-term care communities for COVID. It was very rough. It was very sad, especially the being removed from the community, being cut off. So their safety is their primary concern. So you just need to ask that question: how did they handle it, and how many deaths did they have? I think you can ask that for sure. Some will have a very long protocol. Some protocol may be shorter. You can also, I always like to Google, I'll tell you the steps I take to look at a community. You Google them and then click the news button on Google, and you will find the name of them, or their proprietor, their owner comes up. If there's some bad news in there and it's not just about a local parade or, mentoring, then that's a red flag. Okay. Independent living. So the conversation around living options typically includes centers around health and personal needs. But many people seek supported living situations out of a desire to live more fully, not simply to manage diseases of disability. So for active adults who want to downsize to a home in a retirement community, but don't need much help to live independently, independent living may be a good fit. Some communities, independent living is included inside of the community and doesn't include services, but you can always get services in your independent living place. It's just like your home, and they tend to be often attractive and activities, and of course it's income limited. Independent living can be anything from a trailer park limited age, or to a large community like this one in Florida. They focus on active lifestyle, small apartments, usually have housekeeping, maintenance, universal design, emergency alert systems, planned social events. Usually you purchase an apartment. It's like a small home, 200,000 to $1 million, and then you pay an HOA fee, a homeowners association fee, which ranges from 1,800 to 6,000. This information is all in the slides, so please just take it all in. You're going to get this all written down for you. You don't need to jot too much down unless you want to make a mental note. There are affordable housing, income-based senior housing. It's pretty low income. Most people don't necessarily qualify for that. And there are workshops for how to search for those types of social service agencies. Think about Rossmore. They have an independent living that's like that, or the Lake Merritt is another one. Many, many, many more. But those ones that you might know about in the Bay Area. I have provided links in the slides that you get as a handout that will include how to search by location and name. And if we have time, I can show you for that. I use seniorly.com, seniorly.com, and they have a location finder at the top. They have this little app in the middle that makes you complete a bunch of questions and put your email in. You don't have to do that. You can go to the top and put in your county, or I mean your city. Any questions about independent living? Because we'll move on to assisted living. Let me see here. I'm not seeing chat. Okay. No questions there. Okay. All right. Okay, assisted living. Okay. So these are what you call recreational care facilities. I see a question came in. Are there any independent living equivalent to the photos you saw for the Florida villages? Yeah, those tend to be really East Coast or Arizona, those big neighborhood communities. There are a lot of East Coast where they have land to spread out on more so, but you can search for independent livings in Seniorly's website. How do you assess solvency in these situations? So, Carol, do you mean the solvency of the community in terms of how they are doing financially, or your own solvency? And Linda, are any independent living communities that offer rentals versus purchasing? Well, we'll talk about that, Linda. Um, in assisted living, you basically are renting. They have independent living units that you basically rent. You pay an entry fee. It's usually like first month's and last month's rent. And then and then you pay like a HOA fee almost for their access, their financial stability. So they won't get bought out by other companies. And yeah, that takes a little bit more digging, Carol. I mean, what you can do is see there's some things that you can consider and look at. You can dig in to find, if you dig deeply, you can find who owns them and how they're buying and selling. I know a little bit about that, not too much, but you can see how long have they been around? How long has their company been around? Um, um, how long has their executive director been around? That's often a good sign of stability, that trickles down into financial stability because they have a good model, etc. Okay. All right. Let me just put the meeting chat down there. Okay. So assisted livings are called technically residential care facilities for the elderly. I mean, that's how the Department of Social Service licensed them. It refers to a variety of facilities, but they provide housing and personal care to people 60 and older. They include the board and care homes, so the smaller homes, and which often have 6 beds in the community, and residential housing, as well as much larger facilities like Belmont or Silver, the one locally, or any of the Marriotts, etc. So they're all licensed by the Department of Social Services. So so you can kind of think about, well, how does this apply to me? So roughly 70% of us older than age 65 will need some sort of long-term care during our lifetime, usually around 2 to 3 years. 53% of women and 47% of men will need long-term care in their lifetimes. That could be temporary, it could be forever. Women need care longer, 3.7 years, than men, 2.2 years. So when you're thinking about money and you're thinking about longevity of space living here, typically the span of living in a place like this is 2 to 3 years. So I kind of, you can you can think about the funding of that, and we'll talk a little bit more about money. Would you please address if any of these guarantee a cap on monthly fees? Is it safe to move to a nonprofit for a profit community? Let me talk about that, Kay, when I go over community continuing care retirement communities. Nonprofits tend to have help for people that might run out of money versus they usually have like a benevolent fund. So nonprofits can be better when it comes to that. How do we find information on if a community has kicked out residents and why? Um, yeah, let me talk about that with assisted living. What happens if you live longer than 2 to 3 years and run out of money? Well, at least that's a good question. So I know that's a good question. I'll talk about money in a little bit there. So hold on to your question. If I don't answer it, bring it back up again. And there are certain situations with continuing care retirement that can cap or keep things at a reasonable, at a stated cost, like only a small percentage. And you sign a contract, so you want to look at the contract. If you have a lawyer, you have AROG, the legal assistance program through UC, get a consultation on the contract and have them look at it. It's not a bad idea, but read your contract. That's really, 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 really important. And that will be laid out on that. Okay. So remember what I talked about with ADLs? So assisted livings provide non-medical care and supervision for persons 60 and older who may need assistance with ADLs. Residents should not require ongoing medical assistance from facility staff in assisted living. These communities may care for individuals who have dementia if the facility is adequately equipped with the staff and the are trained. So like a memory care portion of the community. And some have special licenses to provide dementia care and hospice care. So some include independent livings in them, plus assistant with ADLs, like a studio, 1 bedroom, or in a smaller community or a shared unit. The smaller board and cares will have a shared bedroom. Larger communities have many amenities. I've got some checklists and some fact sheets about this so you can read more about that. Assisted livings are, especially I'm talking about the bigger commercial ones. But if you look at a board and care and a commercial one, they're typically from $2,000 to $6,000, as high as $10,000 a month. So what are you covering, right? You are covering to live there, all the amenities. And then as you need help, many of them have assistance in the community where you pay for that help. And it's important that that the community, in order to keep you safe, offer those services. And so that's why it can go up to $10,000 if you need that higher level of support. Everything next to, like, not really, you should be able to transfer on your own. Um, in some cases, depends on the community. But you can't be bedridden at an assisted living. You just can't. Now, there there is some instances, this is why it kind of gets confusing, but there are some instances where you can get a waiver to stay at an assisted living instead of a nursing home. But the waiting list for those hasn't been open since 2017. So it's very hard to get it in case, like, because people are are, nursing homes are not often attractive options for people, and the staffing is hard there, et cetera. So, some of the assisted livings, I mentioned Atria, Belmont Village, Elders Inn, and many, many more. Um, I also include in the links here a what a physician's report form looks like. Now, everybody that has to get admitted everyone who is admitted into an assisted living um is required to have a doctor's this form filled out. And it essentially says if you have a diagnosis, what levels of care you like, what you need help with. So that's an important form because it will give you where you're placed. So you can't if you come in, you're like, I want an independent living apartment. They say, no, I'm sorry, this form has this that requires us to put you in an assisted living. You're often in the same area, as many are not entirely separate. They're together, but they have less amenity, like they don't have a full kitchen inside for assisted living. You have more meals in the dining room, etc. Um, okay, Rachel, is the assisted living place on the right? Sorry. Is the assisted place on the right local to the Bay Area? I recognize the Belmont Library on the left. Yeah, I can't remember where I got this picture for the right picture, but that's like kind of nice. The amenities are nice, laminate flooring, so open doors to get in and out, big doors to roll around. Mm. Mary says, looked at Yelp reviews for assisted living at some local places and have some negative comments. How concerned should I be about that? Well, it may be a start for your research. You might go on the Department of Social Services and see, and I'll give you that link is in here many times in the slides. Um, and you might see how many formal complaints have they had. Yelp is interesting. You could probably use it to how you would use it for a restaurant, quite frankly, but you know, you might try something. It may be a start for your research. Go and look on the Department of Social Service website, go and visit. I know when I was looking for a rehab community for my father, I checked in with a local care manager in Virginia because I was not familiar. I'll talk about care managers. They're incredibly helpful. And she said, go by and see the place. Because everybody was saying to go to this nursing home for rehab. And I went by and I was like, oh gosh. It was, it was the smell. People were left unattended, kind of around the place. There was no one at the front desk. I mean, it was sort of your worst, kind of what you could imagine. So I took him to another place. Medicare covered this. This is for rehab, though. Don't. This is just for rehab, temporary. Like he's not gonna, because we'll talk about that difference when we talk about nursing homes. And it was a wonderful place. It was very nice. The food was good. So go in and look at the place before you double down on a Yelp review. Okay. A lot of information. How's everybody doing? Okay. Let's talk about, these are the home-like ones I talked about. So these are board and cares. They are licensed in the same way these folks are, licensed by the same people. They're typically run by a family or a woman or man. You can share a bed in a house, bedroom in a house. They have like dining room and they have backyards and yards and things. They provide meals, room cleaning, laundry, and activities. They're very bare bones, simple, but more affordable. And they vary just like other assisted livings. Around how they're operated, but they are accountable in the same level of care, uh, to the same level of care as other assisted livings. Usually 6 to 15 residents. It's typically month to month. So these are places where you can rent, just like you said, but it's not your own apartment. It's a room in a house. shared private rooms, generally less expensive. Still not medical care, just needing a little help, getting up in the morning, someone to keep an eye, to check in on, some socialization. Um, so there's several around. They're typically they're affordable. I mean, relatively. I looked at one that looked, I don't know, it sort of checked the boxes, and it was out in the foothills for 2000 or 2200 dollars a month. I would have thought that was, not too bad considering regular ones are 6,000. But you'd have to move to the foothills, so I didn't know if you. So, which assisted living place did you place your mom? Oh, this was my dad, Rachel, and it wasn't assisted living, so I can talk with you offline about that. Linda says that when my mother went to an assisted living, the staff were great. Will you be explaining later what long-term care insurance covers? Yeah, let's get on. We'll move on to that. That's important questions. How ill or disabled physically or mentally are residents in board and care homes? It's the same as an assisted living, one of the bigger ones. You cannot require no, we're talking about for the elderly. There's also other group homes for people that have lifelong disabilities. Um, but these are for the elderly, particularly, they're age-based, and uh, they just like the other assisted livings, you cannot require sort of uh, heavy medical care. So think about your ADLs. That's what they're going to look at. How many can you do? And that's how they're going to look at whether or not they can take you into the community. Okay. All right, I'm going to move on because there's lots of questions coming in. We're going to get to memory care. Okay. All right, memory care is typically inside of a community already. It can be part of an assisted living or standalone. It could be specific floor or a separate section. It's considered secured, often characterized by a locked door or secure perimeters to prevent residents from leaving the facility unsupervised. So social services, in order to get licensed, you have to have that. And that sort of closed off space where they can't elope or leave. They have a special license, and they can cost anywhere from $5,500 to $10,000. So it's once again, Medicare does not cover any of this. So we learned that last week. Just keep in mind, Medicare does not cover long-term stays in any of these. If you're rehabbing and you had a hospital stay and you're rehabilitating, that's different. Medicare will cover that for a certain number of days. But this is private pay or long-term care insurance. And even still, you need to read your long-term care insurance policy, like take it out, shake it off, dust it off. I'm going to give you a couple contacts where you can go have it reviewed, just to make sure. And I'll say some things about that too. I also have some checklists on here on how to evaluate all of these, like a step-by-step guide, checklist for by reputable places, how to evaluate a board and care home. So these are some of the questions that are coming up. Online reports, once again. Okay. All right. So some people like the idea of continuing care retirement communities. It includes all levels of care, and they've been changing over the years in terms of how they do that. Independent, assisted nursing, all on one campus. That's not to say if you stayed in an assisted living, you couldn't go to independent and assisted and then move out to go to a nursing care community. This is all in one campus, and it ranges high rises, acreage of mixed cottages and apartments, um, varying contracts. So I have a slide that talks about the contracts too. Um, Life plan or life care community. So that life plan offers the highest coverage of care and has the highest upfront cost. Okay. So the reason they've created new contract styles is because the high cost of the entry was sort of a turnoff to people. So it can range from 150,000 to $1 million entrance fee, depending on the type of contract. Usually on the million side, you you get a fixed cost across that doesn't your costs are given to you and they don't change significantly. They might have a percentage that they tell you up front. Then the lower entry fee gives you sort of a you pay a little bit more, or you may pay at market rate, but you stay in the convenience of one place. And if you are sick or need nursing care, you can go over to the nursing care, and your loved one who might be living with you can just walk on down to see you. So it's all in one campus, which is nice if you're rehabbing from a fall or having some surgery and you're recovering, need some help or respite, something like that. There's also amount of money that gives back. These contracts often give back to your estate after you've passed on. All the contracts are different. I'm not going to get into the details of them. You just need to look at the contracts. But this is if you're interested in all levels of care in one place, that's your type of community in CCRC. Let me just. And there's checklists here on how to evaluate that. Okay, skilled nursing facilities. They are licensed by the Department of Health. How are we doing on time? Um, okay, we got to move along. So these are licensed by the Department of Health. Um, they help with activities of daily living, um, what is called custodial care. All right, so that's helping you with all of your like bathing, dressing, eating, and you may have stayed at one in recovery at one point. And Medicare covered it because you had a qualifying event at the hospital and you were discharged directly from the hospital. So that's why Medicare covered. But if it goes beyond and you're no longer rehabilitating, that is considered what they call custodial care, and that moves over to $13,000 to $11,000 a month. Now remember, 2 years, some people need that high level of care. It just depends. Maybe a shorter amount of time. It just depends on what kind of help you need, disease you have. Um, Now, some nursing homes are pretty generous on what they consider rehab. Like for my father, if he could just get up and down out of the chair, that was rehab. So as long as you're rehabilitating, you get um, several months, and that can be renewed as long as you're rehabbing. But we're not talking about necessarily rehabbing. We're talking about, I think in this context, I can no longer take care of myself and I can't stay in my home and I need a place to stay. Generally, once you're past your rehabilitative stage, that is called custodial care. Now, what if you run out of money? So this is what a lot of people have asked. There, there is a point where you Medicaid steps in where you become indigent or no longer able to pay for your care. Um, that's quite a process. And what I would recommend to you is if that's a concern, um, to talk about that when you go to the community, how they handle that. If they're a nonprofit, they may have a benevolent fund. Um, how are you going to manage that? Are you self-insuring? So how much money do you want to set aside? I mean, for me, my husband and I will self-insure. We didn't get a long-term care insurance policy. So we'll set aside however much money it would cover for 2 to 3 years. And that's what we'll do. We'll try our best. Now, um, Medicaid, what you want to do is if you start to foresee that you're running out of money, you would want to invest in a care manager that can help you figure out how to walk through that. Next week, Julie Minnick is coming. She's a colleague of mine. She's a gerontologist, a care manager, and she's going to talk all about how to fund and think about how you pay for long-term care out of pocket or with a long-term care policy. Once again, read your policy. That's the most important thing I can say to you in a long-term care insurance policy. And I'm also going to say a few more things about in terms of buying one now when you're in your 70s. Are CCRCs without mandatory meal plans? It's a good question. It would be a good question if you go to find out what the costs are. Independent living is pretty independent. Maybe you might get one meal, but you may be able to not have that. That's a good question. I'll find that out, Martha. If you want to email me, I can ask my colleague about that. Okay, we're getting to the. If y'all want to stay 5 minutes after, if you can, I will go into further questions. Okay, evaluating a nursing home. I've got several things here for you to look at, checklists. All right, so this book I provide a link to. It's a little out of date. The links are out of date, but the concepts are pretty tight. They're good. I use it. I used to use it for a class I taught. It's okay, now I'm overwhelmed and I don't really know where to start. It's a booklet to be able to come, and kind of do checklists and write your thoughts, etc., on everything that we've talked about last week and this week and next week. I have maybe 8 copies of it at the office if you want to email me and come by and get it, or you can print it. It's several 40, 50 pages or so. This is a good place to start. Okay. This is how a lot of my slides looked. So it's a lot of information, right? Let me tell you how I start, or how you should think about what works for you. Look at this book. For assisted livings, you want to go to the assisted living website and look. For nursing homes, that's probably less of what you're looking for at this point if you're planning, but you want to maybe look a little bit at those there. And then Seniorly has an online marketplace that allows you to look at pictures, and it's a little bit more user friendly. The assisted living one is hard. You can go in and the social services department is a little bit more difficult. You can click on reports. There are reports. There are violations. I mean, you can look at different things and kind of read through them. It's very bureaucratic. Seniorly can be very helpful. It's a for-profit, but they work like a place for mom, which is an online marketplace, and they have people that help you navigate it, that don't get paid, that get a bonus when they refer you to a community. Those links, because I want to get to the money part. So I would start first by getting this book and just kind of sort of framing what you want and kind of thinking about the bigger picture. And then when you go to look at them, you can go on Seniorly's website, and then you go on the Department of Social Services website if you're ready to go visit a few and look at that. I would say take the social service website with a grain of salt. Anyone, like I said, can report anything. Like my husband says, anybody can sue anybody for anything. So it's anybody can say anything, and they have to go. The social service agency has to go and address the report, and then they have to tell you whether or not they do an investigation. So it takes time, and then they substantiate it, and say, okay, yes, this very much happened, and this is what the community is doing to amend this. Now, if it's happened several times, then you can tell it's an ongoing problem. But there's several tabs on that. on the pages for that, and it will give you that, and you could spend all day looking at those. You can also go by yourself and look at the places, which I totally recommend. Usually you can get a free meal or also, just kind of go in and look at it, if not just to decide that you never want to live there. I like to talk about alternative options because you got to dig for them. So, and this is the money part. So let's talk about just alternative options. We got a few minutes. Oops, I'm sorry. I'm a little trigger happy here. Okay, I provide links on several things. So the long-term care system for us is sort of dominated by assisted livings, and they can be very good. The staff can be great. They can really provide good care, keep you safe, fed, and in a community. They can be, you can thrive very well in them. But I there are there's options, but they're farther and few between. So co-housing is one example. Think Golden Girls, but also think more formally, communities that are actually organized. Um, Few things about co-housing is, it's communal. Everybody looks out for each other. You share meals together. The people usually run it. The people that live there, it's a co-op, so it's run by the people. It's multi-generational. So children and families and older people are all there to help each other. Once again, it's not medical care, but it's people looking out for people, which I'm a big fan of. Similar with the village movement that I talked about last week. But living in a co-housing environment is different for a lot of people. There's certain rules, and there's a certain like I guess a cultural fit. They want to make sure that you are what they're looking for, but they're also they can be great resources if you want to start your own. If you have a group of people that you have in mind, or you have rules that you want, a certain theme that you want to keep, they can be really great resources how to start your own. I know some people have bought up homes in a neighborhood, and they did it all together, and kind of intentionally. Phoenix Commons is one that you might be interested in going and looking at if it's in Jingletown in Oakland. Phoenix Commons. It is run by a man who ran nursing homes, and his daughter, I think, or his family. They're individual condominiums, and you pay an HOA fee. And I have a link to it here. That's a co-housing environment, and it's sort of more of an institution. It's got private space and public space. I went and toured it. I found it very interesting. The co-housing name is Phoenix Commons, and AARP has a 20 Q&A about co-housing. There's senior only choosing spots. Grass Valley had one. Okay. Could you give, or there's an overview comparison to continuing retirement? Yeah, I will get to that. Okay. Affordable housing. So I said that was there. If you're a certain percentage below, which is pretty generous in this area, the Bay Area, below the household income is below a certain amount, you can qualify for these. I read an article, I don't know if you guys caught it, in New York Times the other day about, she's one of my favorite, Paula Spann. She does all the new old age. Follow her. She's great. She used to have her own column, but now they kind of put her in a just random kind of, I think, under health or seniors or something. It's called Add I'm Getting a Little Older to the Challenges of Apartment Hunting. She actually moved from New Jersey to New York and bought an apartment to be closer to her grandchildren, I think in Brooklyn, or the Brooklyn. So it's a great little article because it's not for the faint of heart. She also hired a move manager. I'm going to talk that's up. I'm going to talk a little bit about that. It was expensive, a couple $1,000s, but she said it was worth its weight in gold to have somebody manage. the move. And then last week I talked about home sharing, but you could have somebody move into your house if it's affordability is becoming an option. And then you can use that money to hire somebody to come into your home and help you out with sort of light housekeeping. So that's kind of nice if you have a home that's available. How Home Match Front Porch is a great program. Um, Before we go to money, 2 minutes on professionals that can help you. Okay, I'm going to talk about three. One is a referral agent, elder placement specialist. So these people they don't charge you. They're paid by the facility if the client moves. They're extremely knowledgeable about local choices, and they'll go on tours with you, several Bay Area. There's several Bay Area housing placements. Now, if you're looking in Virginia and if you sign up for Seniorly, you'll hear from someone. They're not as aggressive as a place for mom, which will call you as soon as you give them your phone number, but they are assertive and they know a lot about the communities. They tend to know a lot about assisted living communities and some continuing care retirement homes, but mostly assisted living communities. I've listed several here. And you ask, okay, that sounds a little funny. They're not paid, but they get it paid by the facility. The ones that Seniorly lists and the ones that I've listed are in it because they care and they need to make, a living. But they're not going to point you to a place that they don't think is a good fit. But they mostly focus with assisted living. So they're like a realtor for senior housing. Geriatric care managers. I cannot say enough about a geriatric care manager. Many people raised their hand last week, didn't know what they were. There's a link here under my slides that I give you, professionals who can help. It's called aginglifecare.org, aginglifecare.org. And, it can cost $100 or maybe a few $100s, but they are they are what I just did for you. They're like a personal daughter or friend, but they know stuff and they know the legal parts. A lot of times they know the things to look out for. It's worth it. If you just want to go and do homework and go do, tour some things, go meet with one, it's worth an investment on you because then you can make those decisions informed. And I think they're wonderful. I think they're some of the best professions. And you don't become a geriatric care manager, because you're in it for the lifestyles of the rich and famous. You're in it because you care. And then I can't not mention area agencies on aging. I've put the number for the elder care locator where you can find your local area agency on aging. They tend to be very overwhelmed and focus mainly on people that might not be able to afford certain care, but they're your local state, your locality from the state office. So area agency on aging. Okay, let's talk about the money. We looked at this last week. That's why I haven't. All right. So let me let you just look at this for a second. This is by the hour, the month, the year. What Julie will talk about next week is, let's say, for example, you want to stay in your home, but you want to figure out how to do it and make your money, stretch. And you could stay in your home and get adult daycare during the day. This is typically for someone that has to, not typically, but they often are people with high level of care that they can go for the day, and they usually have dementia at the adult daycare. So they're not something maybe that, I mean, if you want socialization and activities and you want to stay at your home, then go to your local senior center or your Parks and Rec if you're more independent. But this is good if you're caring for your loved one and you need a break, you need to go to the grocery store. Please take a break if you're a caregiver. It's not just, you can't do it all on your own. It's too much. It's okay to ask for help. I have to say that again. It's okay to ask for help. So adult daycare are throughout the where you live. A care manager can help you find them. I think Seniorly may list theirs on they're usually you can find out about adult daycare though through your area agency on aging, the local. So you see, it's not affordable, right? So let's talk about long-term care insurance. I talked about it last week. If you have a policy, look at it. I'm going to just stop sharing real quick so we can all look at each other. So if you have a policy, read through it. If you haven't bought a policy, um, they tend to cover less than they did 10, 15 years ago, and the premiums have really gone up. CalPERS used to offer was open to offer it to UC folks, but they stopped offering it because of not being able to cover the services or the care, and the premiums have gone up. If you are on CalPERS, check in with your policy and check in just to see what that's about. Just remind yourself. Self-insuring is a lot of what people talk about now. Preparing, getting your house in order, taking care of the health of your house, your health, that's a real savings there. But health issues happen, right? Disease happens. You could be as healthy as you can, but it can happen. So self-insuring. So at least what I mean by that is, put aside, this may sound, $500,000, couple $100,000 for yourself. Just have it set aside, or the value of your house to cover your long-term care. That's self-insuring. Put money away. Put $100 away if you're in your 50s. Put more if you're in your 70s. Just put money away. That's not an option for everybody, but for me, in my late 40s, that's what we're doing. But yeah, if you have policies, you want to take a look at them. How does it work if one person in married couple is in worse health than the other? Yeah, that's a good question. So, every community is different. I didn't mention that, your health and your level of independence or dependence, as well as your financial health for continuing care retirement communities, is evaluated before you come in. So if your spouse your spouse could live in assisted living, and you could live in independent living, you could both live in assisted living together, even if you don't have the same level of care that your spouse has. So every one of them is different, and they all evaluate differently depending on if they're full, if they're, if they need, or just in general. But they do have a certain uh, policy from the Department of Social Services that dictates how they can let people in. But you can live together in an assisted living. It's 11:04. I said I'd stay over after 11:05. If anybody has any questions, we still have 100 people on the call. You can put it in the chat, or maybe you have an example of yourself where I've said something you're like, oh, not quite, Cary. This is the experience I've had. I mean, I still learn stuff. This is just me having paid attention and done research over the years, but I still learn a lot from caregivers who make it work by pulling things together. Caregivers are remarkable people. That might have a tip. With so many considerations on my own, when you're on your own, what's the best way to hire someone knowledgeable? Well, anyone on that, I mean, I would hire someone off the care manager's website, that website I told you about, Aging Life Plan. I would get a care manager and I would see if usually standalone care managers are interesting because they're not attached to a home care agency. So sometimes, but there's also really reputable care managers that are attached to a home care agency. Are they a chain, or are they owned by a person that started it up 20 or 30 years ago? You can usually call most places and they'll give you a free 30-minute consultation. And I will send a fact. We have a list of folks actually that give 30-minute consultations. Um, it's the one that the elder care counselor gives from the campus. I will share that, but most places will give you a 30-minute consultation. Are there any nonprofits or CRCs that have lower rates? I wouldn't say the rate is different with a nonprofit. I'd say it's more about if you run out of money, there's a benevolent fund to help support you. So I would say that more than anything, usually it's long-term care is expensive. These communities are expensive to run, so they tend to usually if you get farther away from the Bay Area, they're much more affordable. I mean, the Bay Area is the highest, and say New York are some of the highest costing communities in the country. Okay. Well, I love seeing all y'all. I was gonna say, if you want to do some homework and then come into the center, we have a big room that has good air ventilation. It holds about 50 people. Um, I will send out a note and of the retirement center where we work, where Sigurd and I work. We're now on Bancroft. We're in the Banway building, and you want to kind of go through this together and ask questions and really do. I want to encourage you to do the homework, and then you just want to ask questions. And I could bring in people that maybe I can't answer certain questions. I'm happy to do that. So we have streaming capabilities, but I think something like that would just be better of us all in the room. So, let me know if you'd be interested in that. After this thing, I'll send out a little survey question that says, are you interested in coming in person? Along with the slides again, we'll send. And, then we could schedule something for that. All right, people are starting to, I want to be mindful of people's time. Any other questions, or did everybody get the slides? You will get the slides following this, so keep an eye out for it. Well, it's good to see you. Thank you all for showing up and investing in this. I know it's not the most enjoyable topic, so but just think about all of the options that you'll have in front of you. So thank you all. Thanks so much. It's good to see everyone. Email me if you have any details. Same time next week. This is my email. It's cary.sweeney@berkeley.edu. And take care of yourselves. I'm so happy to see everyone. So be safe, and I will sign off.